My name is Kathryn Bylow. I'm a medical oncologist at Froedtert in the Medical College of Wisconsin. I specialize in genital urinary cancers. My background includes medical school at University of Wisconsin-Madison. I then did my internal medicine residency at Vanderbilt University and fellowship training in both geriatrics and medical oncology at the University of Chicago. I specialize in cancers of the genital urinary system. What that means is I treat only a handful of cancers, including kidney cancer, prostate cancer, bladder cancer, and testicular cancer, in addition to a handful of others in the genital urinary system. What that means for the patient, I think, is that you get very specialized care and that I only treat a handful of cancers, and that's our approach here at Froedtert Medical College of Wisconsin. My research interests include my background in geriatrics as well, and I'm really focused on functional outcomes and side effects of treatment of prostate cancer, particularly in older men, as they are most vulnerable to the side effects of the treatment that we give them. I'm looking at things like how to prevent muscle weakness and wasting and strength differences that happen when patients are treated with hormone therapy that most men who have recurrent cancer receive. I have a study ongoing here. In addition, we have several studies in all areas of genital urinary malignancies or cancers to provide patients with the options of novel therapies that are looking very promising but are not yet approved. The advantages of working at an academic medical center, I think, are many for both the provider and the patient. I, as a person who specializes in just a handful of cancers, get to focus all my meetings and all my attention on just the cancers I treat. Thus, I'm able to stay up to date on not only the newly approved medications, but also the medications that are up and coming and looking very promising for different cancers. That allows me the opportunity to bring trials in to our medical center to allow patients to get treatment sooner than they would perhaps otherwise. The other thing I really love is working very closely with my colleagues who also specialize in the handful of cancers that I treat. I work very closely with radiation oncologists who specialize just in genital urinary malignancies and also urologists. Often we're seeing patients working out of the same physician workroom at the same time, so in real time we can talk to each other about patients, get opinions, and share thoughts. Not only is that very rewarding for me as the provider to be able to talk in depth about patients with my colleagues and peers, but I think patients also receive better care because they're really getting very specialized care for their cancer.